A national mental health study reveals that more Singaporeans are aware of common mental health conditions and able to recognize them. Stigmatisation has also reduced significantly. Analysts say this high mental health literacy rate will enable those facing mental health issues to better seek treatment without fear of being judged. The study by the Institute of Mental Health comes 8 years after it was first conducted. Over 4,000 residents were given a short story of a hypothetical person with a mental health condition like dementia, alcohol abuse and depression. They were then asked if they could recognize the symptoms. Nearly 6 in 10 respondents were able to do so. This is up from about 4 in 10 from the previous survey. 2 mental health conditions were also included this time around: gambling disorder and depression, leading to suicide thoughts. Over 7 in 10 respondents correctly identified these conditions. Respondents were also polled on their attitudes towards those living with mental health conditions. 3 domains were measured: whether those with mental illness were personally weak and not sick, unpredictable or dangerous, and the extent to which one would distance themselves. Stigmatisation scores in all 3 domains fell when compared to the previous study. In general, females and those aged 18 to 34 had lower stigmatising attitudes. Researchers say more can be done to shift societal attitudes of the older generation.
We are also seeing that among the older age groups, as well as those with lower education, there is higher levels of stigma and lower rates of recognition. So more interventions can be done with this group, for example, by going out to the community and speaking to them, and maybe having some interventions that are, in dialect languages or in the second languages.
Speaking at a conference on mental health, Minister of State for Social and Family Development, Sun Chueling, says Singapore is focusing on early prevention for mental illnesses. For instance, excessive digital use for youths may lead to addictions or disorders. She says it's why new measures to manage device usage will be rolled out in the coming months.
Addressing these behavioural addictions also requires collaboration across public agencies, schools, healthcare providers, and the broader community. We have to integrate education, prevention, and treatment strategies so that we can mount a more effective response to addiction. Early detection and timely intervention are crucial in preventing these issues from escalating.